Thanks, Barney. Hi, everyone. Thank you for having me today at your coffee morning. Yeah, I am a PhD student. It's on a bit of a pause at the moment because my activities can't continue during COVID. So in that time, I've been involved with a few different COVID projects, and that's the one I'm going to talk to you about today. Before I start sharing my screen, I just wanted to kind of gauge what you already know about the Southampton COVID-19 saliva testing programme. So I just wondered if you could raise your hand either virtually or on your camera if you have heard of the saliva testing programme in Southampton. So just give me a little wave, or you can raise your hand virtually if your camera's not on. Okay, so it sounds like a lot of you already know about the programme. And who has taken part in the programme? Who had an invitation? I don't know if many of you would have, but maybe it doesn't look like there was anyone that has actually taken part. Okay, that's good to know. I just wanted to kind of gauge what everybody already knew about the programme. Okay, so hopefully you can see my slides now.
Yes.
Great, perfect. I'll be talking to you about the Southampton COVID-19 saliva testing programme, but mainly about what we did for the qualitative evaluation. So that was with the participants and decliners, and we gained feedback from them. So I worked with a team of, there was 12 qualitative researchers in total. So there's a nice picture of those researchers at the end, I'll show you. So yes, we conducted 97 interviews and focus groups with 221 people. And this was all about the saliva testing programme. So just to take you back to the beginning, in June, the University of Southampton staff and some students who were living in halls and also some GP practices were invited to take part in a very short pilot. So this is where they received a testing kit either by post or at their place of work. So that was GP surgeries. And then you might be able to see the little test tube here. They basically spat in the test tube and then did the test kit. So there was 2 bags, they had to put some labels on, and then they took it to the drop-off points. So in the GP surgeries, there were the drop-off points at their surgery. But for the University of Southampton people, they had to go to a drop-off point. For me, I was very lucky. It was about 5 minutes walk from me. And then in October, so that only happened throughout July, and then the second pilot happened in October, and that was also with University of Southampton students this time, and selected staff who were going to campus and engaging with other people, but also 4 schools were invited, so that was infant, middle and secondary schools. So what we did for the evaluation is that I guess the aim was to understand and explore the participant and decliners' experiences of the programme, just understand if, how acceptable it was for them, what they thought went well, what they thought were the challenges. And with the challenges, we provided real-time feedback to the testing programme team to improve the experience of the programme for them. So, I mean, there was a lot of challenges, I guess, in the first pilot in July, and then between the first and the second pilot, we made a lot of changes. So for instance, labels are a lot smaller, and just all the very practical things that we could improve on. And also our interviews and our focus groups contributed to the final reports that went to Cabinet Office. So they also saw parts of these results. So these are the people that we spoke to. So these were university students, university staff, senior leaders, such as those setting up and running the programme, school pupils, so that even included, I think the youngest one maybe in year 1 up until I think year 11, parents of those children taking part, school staff who were also taking part in the programme, school senior leaders who were helping to set up and run the programme, and also GP staff. So what I'd like to talk to you today about are the findings that we found, and afterwards I hope hopefully in our discussion we can kind of talk about these findings and see what you think about them. So we had 3 research questions that we wanted to answer. So the first is, what made people engage with the testing programme? So we found 4 main themes around this. So the first one was around communication. So the discussants, they said if there was good, transparent communication, this made them engage from the very beginning. They're more likely to register to the programme, and they're also more likely to continue to engage with the programme. So for instance, this parent you can see in this quote was saying that the school head teachers were very good at communicating, and I think especially in the schools they were very good at, they had a newsletter that was coming out every single week with some of the, I guess, the findings around positive and negative results, and just trying to keep up the engagement. And then in our second theme, community spirit, I think most cohorts spoke about sort of, wanted to take part for the greater good, wanted to, help science and help the fight against COVID. And as you can see from the school pupil, they said that they were, I think this child was in year 5, and he said, "We're all in this together," which we thought was a really nice quote. And then also the participants, we wanted to make it acceptable for them. We wanted to make it as easy and convenient and quick as possible. And actually they did say that it was, there was a few teething problems at the beginning, but mainly they found it very easy. They found it easier than the swab test, and the results, I mean, in phase 1, the results took around 24 to 48 hours. But by phase 2, the range, I think 10 hours to about 48 hours. So it got a lot quicker, I guess. And then thinking from the managerial perspective, we spoke to senior leaders in all of the, the university, the schools and the GPs, and they all spoke about leadership buy-in. So you can see from this quote, winning the hearts and minds. They spoke about making it logistically easy for them to set up and run. Yes, so just making it easy. I guess in this situation, the schools were also thinking about how to keep their schools and also the universities open with infections rising. So our second research question was, how could engagement with the testing programme be improved? So we found that extra support for those who might receive a positive result and then would have to self-isolate. So from this quote, you can see that people's work would be affected. If they were self-isolating, they wouldn't be getting their income. So the testing programme, or potentially the university or the school, or wider the local authorities, might need to support financially those people. But there was also discussions around people's mental health and providing social support for those who are isolating, especially those living alone, and also the university students in their halls. And also thinking about, food supplies and medicine for those isolating. In our second theme of this question is about building trust. So some of our participants, but especially those who declined to take part, was speaking about, being a bit wary about their data, where it was being stored, who had access to it, what was happening, to their nose cells and their swabs, where was it being kept. And I guess because it was government funded, they spoke about having mistrust of the government and kind of any associated programs. So we felt that any kind of testing program will need to really build up that trust. And I guess that links to the communication theme before, about making it very open and transparent. The discussants also spoke about making it more accessible and inclusive. So this included thinking about different cultural groups and language barriers, and trying to, translate all materials, but also about geographical location, trying to make drop-off points, not so that people had to get on public transport to get to them, and also thinking about, I guess, upscaling, and in more rural areas, how many drop-off points there would be there. And then there was some, I guess, the practical information. So this is also about drop-off points. They only knew about 1 or 2, but also there was practical improvements around the registration at the beginning, about receiving test kits, and I guess just all the little logistical things that needed to improve, which these were the main things that we then fed back to the testing programme that were adapted in real time. So that was really useful information to gather. And then our final question was, what were the impacts on participants of engaging with the testing programme? So we found both positive and more negative or concerning impacts. So for the positive ones, the discussants spoke about feeling pride, feeling pride for being part of the programme. They felt privileged. They felt very lucky to be involved with a programme. I remember one university student, I think, said that his friends in other universities were envious of him taking part in the programme. So it kind of had a competitive edge for the University of Southampton. Some participants spoke about being reassured. So you can see from this quote here that a parent was saying that they felt more comfortable and relaxed to go and visit their parents, their children's grandparents, on receival of their child's negative test result. And I know that people felt that they could continue with life more. So children could go to their after school clubs, and people felt less anxious if they were taking part and receiving hopefully a negative test, or even if they did receive a positive test, they knew that they were no longer spreading it because they knew their result. And they also, so some school students, but also some university students took part in an educational activity around the testing programme. And they found, they expressed that their knowledge about the testing programme, but also about COVID increased, and also the preventative behaviours. So about, social distancing and wearing masks. Moving on to some of the concerns, some participants spoke about environmental concerns because there's a lot of plastics in their testing kits. There was 2 bags, the pots and labels, and I guess and there was a lot of spares, especially in phase 1. So I know a few participants were quite concerned about that on a scaling up level. Some had transmission fears. They acknowledged that you take your test, and then between the time you get your test result, you could then still catch COVID and still be spreading it like that. And also some spoke about transmission fears at drop-off points, which was mainly in phase 1, I think. But I think in phase 1 people were at the drop-off point and getting the tubes, but by phase 2 no one was at the test drop-off point. It was just a kind of post box. So that kind of reduced people's fears about that. Some had feelings of uncertainty when they were expecting their test result, the kind of anticipation of potentially getting a positive result, depending on if, what your self-isolation situation would look like and if you had any underlying health conditions. Some spoke about having more responsibility, and this was especially for those setting up the programme. So as you can see from this quote here, that GP staff felt that they were expected to do a lot more with setting up the programme, such as, gathering the test kits and sending it out to their staff. And then finally, our last theme was on cultural concerns. So as I spoke about earlier, there were some language barriers, especially at the schools. So having to consider that, and also trying to translate all the materials. But also there were some concerns around mistrust of the government. And I think that did depend on people's, backgrounds and the countries that they had come from. And because this programme was funded by the government, there was some issues around that, and they were less likely to take part. So from that, we had a few recommendations that we fed back to the Cabinet Office about testing programmes. So this was to communicate transparently and continuously, harness community spirit, and consider how to incentivise participants and ensure all logistical aspects of the programme worked well for the participants. Provide extra support for participants and households testing positive, build trust around the programme, increase accessibility and inclusivity, and collect data to feedback in real time on the practical improvements. And consider the positive and negative impacts on participants, including a sense of pride, reassurance, and increased knowledge of COVID-19. And consider participants' fears of transmission, uncertainty, responsibility, cultural and environmental concern. So that's all I have for you today. I'd just like to say thank you to the amazing research team who gathered all this data in a very, very quick time. We had about 3 weeks to collect it all, which was quite crazy. So thank you to those. And I think a few of you are on the call. And I think, is it time for any questions and discussions? I'm not really sure how this works now, Barney.